Can you see my screen? Hi, so I'll be talking about how to develop a good answerable research question. And I'm going to ask you a very simple question at the beginning. Which planet is closest to Earth? Now, what would you say? Some of you might probably say Mars, some of you might say Venus. But I would argue that your answer to my question, which planet is closest to Earth, should be, well, that's not a good question. Please be more specific. Why is that? Well, so if you hear that question, you might think of one of those mnemonics, like my very educated mother just served us nachos, so you know, representations of the solar system, or the sun, which is really big and really hot, and then there's Mercury, Venus, Earth, and Mars, and you think, oh yeah, Earth is sandwiched between Venus and Mars, so the answer must be Venus or Mars, right? But we all know this representation is, first of all, not to scale, and second of all, we know the solar system is not static, but planets are orbiting the sun. So what do planet is closest to Earth? Do I mean which planet has the shortest average distance to Earth? Or do I mean which planet is the closest for the longest time? Because, like I just said, they keep moving around in space all the time. Or do I mean which planet ever gets the closest? Or do I mean which planet takes the least amount of time to travel to? These are by far not the only interpretations of the original question, which planet is closest to Earth. I could also ask which planet is closest to Earth right now on the 5th of October 2020. And these are four perfectly valid questions, but they're all different. And you may or may not be surprised that the answer to the first two is Mercury, the answer to the second is Venus, and the answer to the fourth is probably Mars. But we'd have to go there first to be sure. Okay, so what's my point here? My point is that it's very easy to ask an imprecise question, which planet is closest to Earth? Not only in rocket science, but also in healthcare research. And in order to get a good answer and to get the answer that we want, we have to ask better questions. We have to ask answerable questions. And again, it's very easy. So these are just a few examples of unanswerable questions. What's the meaning of life? Is there anybody out there? What is love? What's the best way to lose weight? Do blondes have more fun? Did Tony Soprano die? And we also ask these kinds of questions. So you might giggle now and say, oh yeah, of course they're unanswerable, but we're scientists, we're researchers, we're better than this. But we also ask questions like, well, does the treatment work? Or is my new intervention any good? Or if there's a statistician in the room, you might ask them, well, is it significant or not? But that's not really what you're interested in. And it's also not sufficiently precise and certainly not answerable in a satisfying way. So we need a better framework for asking questions. And a framework that is very useful in the context of healthcare research is the so-called PICO framework, which is an acronym, and P in PICO stands for population or patients or problems. So what population or what patients are you studying, or what's the problem that you're interested in? In my example here, the population is adults with moderate depression, and you would probably have to be more specific and define what you mean by adult and which age range, for example, and also how you define moderate depression. The I in PICO stands for the intervention or exposure, which isn't an I, but it's pronounced kind of similarly. So the intervention in my example here would be cognitive therapy. So you want to know something about cognitive therapy. That would be an example of a question for a trial. But if you're doing an observational study, for example, you wouldn't have an intervention technically, but more like an exposure. And you also want to compare it to something. So C is the comparator or the control. So if you add cognitive therapy to usual care, and as Kim just said, you have to be specific what usual care or standard of care is. then what effect would that have on which outcome? So here, would a depression score, quality of life score improve if you added therapy A to therapy B? So that's a valid, answerable question. It's a very precise question. Like I said, it could be even more precise, but the PICO framework isn't necessarily a recipe that you must follow all the time, but it's a very, very useful framework when asking yourself, am I asking the right or the best question, or the question I'm actually interested in? There are other elements to asking good research questions in healthcare research. For example, many studies are described as superiority studies. That's when you want to know, is something, typically something new, something you've developed, or something that's the latest craze in your field, is that better than something else, typically standard of care? But you also might want to know, is something as good as something else, in the sense that there might be a new treatment which is a lot cheaper or easier to administer, but you also want to know if it's if it works as well as the current standard. And that's an equivalence question. Equivalence is not the same as being exactly the same. So you'll never have the exact same effect, because there's always sources of uncertainty and variance. And that's why you would specify deltas. And then if something does not exceed a delta, then you would say it's equivalent. But you might also be interested in whether something is not inferior in the same context. So if you have a new treatment which is, for example, cheaper or easier to administer, then you might want to know, is the effect it has on the outcome at least not worse than with the current treatment? And then there are these F words: efficacy, effectiveness, efficiency. You'll find them in literally every grant application, but people often get confused, and people often don't use them in the way they mean. So what do these words actually mean? So when you do an efficacy study, your question is, can it work? So this is typically a question you would ask in a study with an explanatory design. So you have very well-controlled inclusion criteria, narrow inclusion criteria. You have a highly controlled research setting, and you want to know, does this new treatment, new intervention, have a chance of working in the real world? Whereas an effectiveness study asks the question, does it actually work in everyday practice? So an effectiveness study would typically be a study that you run under more realistic real-world conditions. So you would have broader inclusion criteria for study participants and a more pragmatic design. So, for example, a study that you would run in a similar setting, the one it would be, so if the intervention were to be rolled out across the NHS, you want to study it, how would it work in that setting rather than in a highly controlled research setting. And that's an important difference. And efficiency is an entirely different question. Efficiency is about the use of resources, and that's where, if you have questions about efficiency, you should probably get a health economist involved. So the question here is it worth the effort, even if it's effective? Is it good value for money? And that's obviously something funders are interested in as well. And Sue has mentioned outcomes. So outcome is obviously the O in your PICO. And there are lots of questions we have to ask ourselves when specifying outcomes for a study. So which one's our primary outcome? And then do we want to look at secondary outcomes as well? They obviously have to match the study aims and objectives. So outcome is no good if it's easy to measure, but it doesn't actually tell you something about the question that you're actually interested in. They shouldn't only be clinically relevant, but they must be relevant to patients. Again, that's where PPI comes in. So do the people who you're doing research for, do they think that that would be an important outcome to measure, an important improvement to realize if your study was successful. And then there's the question, do you want an outcome that's objectively measurable, or do you want an outcome that's more subjective? For example, a patient-reported outcome, if you ask study participants about how they feel or how bad their pain is, that's something that's not an objective measurement, but that might be immediately relevant to them, whereas something that's easy to measure objectively, like a biomarker, might not have a real impact on how on their well-being, or how they feel, or whether they think treatment is an improvement. So there's always this kind of trade-off between objective measurement being more certain about the effect, versus having something that matters more to patients. Then you have to make decisions on when the outcomes should be assessed. Are you interested in short or long term? For example, survival. Do you think short term or long term survival is more of an issue in your condition that you're studying? And also, you're obviously interested in positive effects. You want to know if whatever it is you're studying has a positive effect, but it might come with side effects. It might come with negative effects, and you also have to have outcomes to capture. And then other questions like, are your outcomes sensitive to change? But it's always helpful to consider systematic reviews and, as Sue mentioned earlier, core outcome sets. So if they exist in the area of your study and you ignore them, that's probably going to be a big no from the funder. So it's really important to get the question right before you think about your study. It's tempting to start with a study design, but it's really not a chicken or egg question. The design obviously follows the question. You have to know what you want to know before you can start thinking about the how. And now some of you might say, well, you've talked about PICO, but it's all for quantitative studies, right? And I say no. You also need a similar framework if you're doing quality research. So quality research is fundamentally different from a quantitative study, from an observational study or a trial, for example, in that it's more inductive and more exploratory. So going back to Mars, it's really just sometimes creating more questions for other studies or for other parts of your bigger study. But even in a quality study, you have to frame your research question in a useful and answerable way. So you have to state your aim, you have to state your objectives, even if you don't have an a priori hypothesis. And you must focus on a single phenomenon or concept or idea or a few. So it's not helpful if you keep it as broad as possible. You would typically want to state a goal, like I want to identify or explore, understand or characterize the experience of something. But again, you have to identify the topic of interest very clearly, and you have to define a sample and a setting in which you're doing your research and to which it should apply. So this sounds fairly theoretical. Let's look at an example. So we're going back to PICO, and P in PICO is the same as it is with a quantitative study. So the P is again population that you're studying or the problem you're studying. In my example here, caregivers of cancer patients, clearly defined population. The I, however, is not an intervention, because in most qualitative studies, you wouldn't be trialing an intervention in the same way that you're trialing an intervention in a randomized controlled trial. It's more about what you're interested in or what kind of experience you're trying to investigate. So what are caregivers of cancer patients' experiences in providing home-based care? Again, that's a very specific topic. experiences in providing home-based care. And you don't have a comparator here, so the C is not your control, and the O is not the outcome, but CO is rather the context. So the context in my little example here is rural Wales. So this is a relatively specific and answerable question. Again, it's just an example. It could be and probably should be even more specific. Just to give you an idea that yes, PICO also applies to quality research questions. And we're going to do a breakout session in a minute or two where we're going to give you a PICO worksheet, and you can have a look at examples of PICO questions for different types of studies, and hopefully one of those types of studies is reasonably similar to what you're planning to do. We're going to do that in the breakout session. For now, I just want to, so again, this is PICO. I just want to sum up. We've seen asking good questions, answerable questions is tricky. I'm going to finish this little talk with a quote from an American philosopher who you might know, who said, as we know, there are no knowns. There are things that we know, so we don't need to do research about them. But there are also things that we don't know them. These are known unknowns. These are the things we want to do research about. But then there are also the unknown unknowns. These are the ones we don't know, that we don't know them, and they tend to be difficult, especially in research. That's why research is complicated. Otherwise, everyone would be doing it, right? That famous philosopher, of course, was former Secretary of Defense, Donald Rumsfeld. Okay, this is my final slide. If there's only one thing you're taking away from this session is know what you want to know, and if you want a precise answer, you must ask a precise question. And that's what we're going to do now in the breakout session and use PICO. And that's the end of my presentation. Any questions about PICO?